Okay, this video is going to cover the use of the Hoyer to get patients in and out of bed, either to wheelchairs or sometimes swimming pools or toilets, whatever they need. So this is used for patients who are very dependent or are max assist, probably 2 or more. There's not many moving parts, but what you have here is the lever at the bottom to either narrow or widen the base of support. You want it as wide as your room or your space will accommodate. Then you have this lever which raises the bar and the patient up, and it's pneumatic, so when you want to lower the patient, you loosen this valve. It's not weighted right now, so it's hard to see, but that will loosen the valve and it will lower the patient. The next tricky part that you have is the harness. This is the harness. The handle always goes to the outside, so make sure that this is not between the harness and the patient, so it goes like this. To get the harness ready for the patient, it's easier to fold up one side. So I'm going to take this leg piece and fold it up, tuck in all the straps, and then fold it in like this. And then this is going to get tucked behind the patient. So it's usually easier if you have help, so this is going to help me. We're going to ask our patient to help roll himself, assuming that he can. So let's have you bend one leg up and then the other. And you're going to look towards Chris and reach towards him and roll over onto the right side. Nice. And I'm going to place the harness underneath him. Try and get it tucked in there as best I can. Yes, I can try. And this is placed roughly between his pelvis and his shoulder blades. Okay, come back over towards me. And now roll my direction, so push and reach. And Chris can unroll. Okay, come back. So we're pretty much almost ready to get the machine. These leg pieces go underneath the patient's legs, and they get threaded one through the other. Let's try and get that under his leg a little more. Okay, now you can relax your legs. Sometimes you have to raise the bed up a little bit in order to get the Hoyer underneath. Looks like we're clear. The other thing is, I gotta make sure you clear the patient. So I'm gonna raise this up a little bit. And we're gonna turn these bars. These bars go this way, or sort of parallel to the patient. Another way to remember that is never give your patient a handlebar mustache. If you have it like this, once he sits up, he's going to have a snidely whiplash mustache, so we want him this way. Okay, before we weight this device, we want to make sure that this valve is closed, but just barely closed. Okay, and now we're ready to, I guess I'm going to lower this a little bit. We're ready to put the harness through the hooks. Okay, so have the patient cross their arms, cross their chest. Let's use both straps here. And let's do the longest ones here. Whew. Okay, now I'm going to start cranking the patient up. What Chris is going to do is help the patient sit up as the bar is raising, and as soon as possible, Chris, you're going to grab that handle in the back and kind of shake the patient down and see what they get. Looks like you left one second up more. Yep, and let's grab that handle. And there we go. Now, yeah, you can put a knee on the bed if you need to help them. You can relax your knees. Make sure, yeah. I use the longest straps here, which means your legs will be the lowest setting, but that also means the hole's the biggest. So we'll see. We'll see. We made the hole too big. You feel like you're
No.
You're gonna stay. Okay, so patient just needs to clear the bed. Now I'm gonna pull him out. One thing you want to make sure when you're moving the patient by rolling the Hoyer here is that the patient's never just swinging freely. There's always somebody's hand on him. So as I pull back, if I'm going to pull back, if Chris has to let go, then I'm going to grab on. So yeah, so why don't you come around? Go ahead, you can pull it back. Pull, yeah. Okay, we're going to actually turn, so you're going to come towards me. So I'm going to get a little bit trapped in here. That's okay. Go ahead and keep turning. Yep. And I can right now turn him. Nope. Turn him this way. Okay, watch your knees. Help me watch his feet and his knees. Okay. You have him? Go ahead and put your hands on his knees so that he's still steady while I go get the chair. Okay, we're going to lower him into the chair. Whether or not you put the brakes on the chair or on the Hoyer is kind of a matter of preference. A lot of people don't use either because as this arm comes down, Vic's going to actually come farther away from the Hoyer. So we need to have a little wiggle room here so the chair can move and adjust. So that's kind of up to you guys as far as using the brakes on the chair. Same with the Hoyer. Chris, you can go ahead and lower him. My job is going to be to hold on to this and pull on him so that his bottom lands squarely in the chair. So go ahead and try and lock that. A little more. Okay, stop. You want to make sure that the harness, the bars don't hit the patient at all. I'm going to back up the chair. If we, are you trapped? If we plan this differently, we'd back up the Hoyer. Okay. Now I'll lock the chair again. Let's go ahead and lift up help lift up his leg and get the pad out from underneath. And then you go ahead and take him, bend him forward towards you. And then I can pull this out. And then we can readjust him in the chair too from there. Okay. Okay, then go ahead.